Hello, hi. Welcome to this channel, Talk Insurance with Hannah. My name is Hannah Atomode for my new journals. On this channel, we simplify insurance terms and we help you with your insurance decision. So in my past episodes, I've been talking about health insurance. So today I have Sheyi Sanusi here. We're going to be having a chat on some questions that was sent to me while I was running the series of health insurance. Welcome, Sheyi.
Thank you. Thank you for having me here.
All right. Okay. So I'll leave you to start. Yeah.
Okay, thank you. It's a pleasure being here. Our first question goes thus: what is the key difference between an HMO plan and health insurance policy?
Oh, okay. Yeah. So let me start by saying HMO is an acronym. So HMO means Health Maintenance Organization. So health maintenance organization are the insurance companies that sells health insurance. So health insurance are sold by HMO, health maintenance organization. So if you want to buy health insurance, the insurance company that is in charge of selling health insurance, they are called HMO. We also have NHIA, that is National Health Insurance Authority. That has more to do with people that work in the public sector. They're the one that ensure that all public servants have health insurance while working with the government.
Okay,
Yeah.
thank you. So can the public servants subscribe to an HMO plan, or they're just strictly based, or they can just subscribe strictly to the NHI?
Oh, okay, yes. They have NHIA. If you're working with the government, you have NHIA. But sometimes when you have access to this HMO, then you see their health plans, you see the benefits. Like some of them have gym service, body spa, and you feel like, okay, on your NHIA, you don't have these services. You can decide to buy health insurance from an HMO. So yes, a public servant can also buy an health insurance, but you're going to be buying an individual or a retail plan.
Okay,
Yeah.
thank you, Mama. So for clients emigrating or traveling long term, do we have a jackpot insurance product that meets visa or embassy requirements?
Oh, okay, yeah. For Jackpot, there is no insurance called Jackpot insurance, but there is travel insurance. So when you are traveling abroad, we have health insurance that have for different period of time. We have for 1 week, for 15 days, for 30 days, 60 days to 2 years. So when you are traveling, we have the one for multiple entry, 1 year, multiple entry, 2 years. So if you're traveling abroad, you can get health insurance for your visa approval. And also, when you travel abroad, you can access emergency health care. So accidents, death, repatriation, dental care, they are under your travel legend. But you should note that this is only applicable when you are traveling on a visit. But if you are going to be resident in that country, you need an health insurance that is sold in that country for you to be able to access care. So the health insurance that we provide in Nigeria is just for you to access care while you are traveling on visits. And also it covers students too. Students that are traveling to go and study abroad for 2 years. There's also an health insurance that takes care of their health while they were in the other country.
Okay, so if I'm going on a vacation, a business trip, it is mandatory and compulsory I subscribe to an health insurance.
Sure, yes.
All right, thank you very much. So for can an individual subscribe to an HMO plan for family, or is this strictly for corporate organizations?
Oh, HMO, they have like retail plan and they have corporate plan. Corporate plan is for organizations that have from 20 employees, and also some of them have for SMEs, companies that don't have up to 20 employees. They also have a retail plan. Retail plans allows individual to buy health insurance. Like let's assume I'm not working and my organization don't have, or probably I'm working where they are not subscribing to HMO. I can walk up to any HMO and buy health insurance. I can as well buy for my family. I will make sure that my husband, my children, they are all my dependents. And we have plans that enable us to even twist the premium. So if you are just a family of two, You're going to pay different premium. For someone that is a family of five, it's also a family plan. If it's a family of three, different premium, family of four, family of five. So this, all these are available with health maintenance organization.
Okay, well understood. That brings me to this question.
Yeah.
Okay, I was going to ask if there was a minimum number for the family, but I think you've answered that one. So now, going back to the first question, which is the HMO and the NHIA, I actually have an idea that I know that, okay, for those of us that have parents that work in the government parastatal
Mhm.
and as dependents using their NHIA, which was formerly NHIS, once
Mhm.
your kids get to the age of 18,
18.
they no longer have access to that health care,
Mhm.
but your spouse have an access to it to your retirement age. So I want to ask for the HMO plan for family, for dependents, is there an age limit?
Yeah, for an HMO, once a child is 18, that child is classified as an adult.
Okay.
So the child is supposed to buy an HMO and health insurance for his or herself.
Okay.
Yeah,
Well understood. I'm sure our viewers will understand now.
yeah.
So now my next question is this. How does HMO plans treat pre-existing conditions? Are they covered at all? Because we know most of us have aged parents that have diabetes, ulcer, hypertension, cancer, and all that. And we would want to like reduce our expenses when we get to the health care and everything. So does HMO plan treat it and how is it covered?
Okay, I'm going to treat your question under two things.
Okay.
So number one, for pre-existing conditions, their period, we call them waiting period.
Okay.
So for some insurance company, their waiting period is 12 months, some is 24 months. So what this means is that once you buy health insurance today, there are some conditions that you cannot access care for. Diabetes, hypertension, people that are on routine drug, pregnancy, you cannot access care immediately. You have to wait for the period of either 12 months if the HMO is 12 months, or 24 months if the HMO is 24 months. So that's why on several occasions I see young people, spinsters, bachelor, I'll advise them to get health insurance, because you may not know, you can even get married today and you get married, you said, okay, let's buy health insurance, and the following month you are pregnant. Because that there's a waiting period, that pregnant wife cannot use the HMO. You have to pay for the antenatal, the delivery out of your pocket. But if you have had an HMO running before this period, you will just ensure you just go to the hospital and your antenatal will be free. Like, it's not free, you've paid premium, but you know what, for people that have had this experience, they know how much you have to pay for delivery, for antenatal. Sometimes you even have CS, and your CS can be as high as 500,000 naira, which a premium of 200,000 for a year with other things would have taken care of. And also for our age parents, because of the age limit to health insurance, some insurance company, they said their maximum entry age is 65, some is 70. Now I know of an insurance company, but I'm not going to mention the insurance name because I don't want to do a kind of advert here, but they have a product for age parents. So if you are age 65, 70, but the premium is high, especially for a parent that have an existing ailment, because if you are diabetic, if you are hypertensive, you have to be on a routine drugs. So the premium is as high as 1 million naira for 1 year. But whatever care that you want in that period of insurance, you will get it from that HMO. So that's a different product. So it's actually broad. Just talk to us. We can design a product for you. We can advise you on what you need to do and what you need to know. And I think that's going to solve your problem.
All right, thank you very much. So that brings me to this last question. If I subscribe to an HMO plan today, what is the waiting period before my coverage starts?
Yes, as you are paying your premium, we can access care
All
immediately.
right,
Yeah, immediately.
thank you very
Except
much.
for those conditions that are to wait for the waiting periods. But for malaria, typhoid, accidents, whatever emergency, you are covered.
Thank you very much.
Yeah.
Thank you for having me. So I think I would just want to like to touch a quick one or two Probably if you can actually just give us an example of what the policy looks like, because we know, okay, for HMO you said there are some plans for like spa, for like gym and all that. I know most people, once you say HMO, all their mindset is like, oh, hospital, clinic, and some of them will just say, I don't think I need it, I've not got to the hospital. So I just want you to give us like one or two convincing points on, okay, why I think, okay, let me just subscribe to this thing, even if I might not be using it for like 1 month or 2 months.
So for your HMO, in fact, sometimes you are even covered for your mental health. We have physiotherapy, we have spa, we have dental, we have optical. If you're using lens, there is a premium, there is a amount that you can get when you have them. So there's optical, there is spa, there is gym, there is dental, there is mental, like if you are having mental physiotherapy. So it's all encompassing. It's not only when you are sick. And you know what? And also there's also a routine check. It can be a comprehensive check once in a year. Just walk up to your hospital. Once it is covered on your HMO, they will do all round check for you to check your blood level, your blood pressure, your sugar level, and you know that you are fine because you are not going to pay for this check out of your pocket.
All right, thank you very much.
Yeah. Okay. I think that's all, Shay.
Yes, so that's
Oh,
all.
okay. It's fun having you, Shay.
Thank
Thanks for
you.
coming. And also for viewers, I feel you might have got one or two things from this interaction with Shay. So I want you to please help me subscribe, share with your friends, and also like and comment. We still want you to send in your questions because in the future we are still going to have an interactive section like this. So just don't hesitate, send in your questions and we are going to answer your questions. So thanks for watching this episode and I hope to see you in my next episode. Thank you and bye bye.